it works. Thanks, Wayne. So the slide that just flicked up there a minute ago was actually just a bit of information about our LHN. For those of you who aren't familiar with those statistics and the coverage, so big area, a lot of activity. So this meeting relates to our 5th year as a board. We're now into our 6th year as a governing board. So the board was established in 1st of July 2019 following the devolution of Country Health. Dr. Peter Joyner was our chair for the first 5 years and did a fantastic job setting the groundwork for our local health network and the board. We had 7 skills-based board members in 2023-24, and a new member joined us on the 1st of July, Robin Valentine, who's with us tonight. Between all of us, we cover expertise in health management, clinical governance, aged care, commercial management, finance, Aboriginal health and provision of health services. So there's many years of experience in the system and in related areas on that board. We have committees for finance, clinical governance, one specifically looking at aged care and disability, which of course is a big area of interest for everybody, a lot of change in those areas, and an audit and risk committee. So they've all continued in 2023-24. And the board does self-evaluations continually to look at what education we need, what our skill mix is, whether there are other areas that we need to look at getting people and expertise onto the board. So the governing board members, as you can see up there, are Mel Ottaway, who's also with us here this evening, me, Claudia Goldsmith, who I believe is on the live stream, Fred Toogood, who's with us here this evening, Dr. Peter Joyner, Sonia Waters, who's unfortunately not been able to be here but is our Aboriginal health representative, Richard Hearn is also here with us tonight, and Robin, as I mentioned before. Richard and Robin are not pictured there because they're relatively new members of the board. There's this QR code there if you want to scan and get more information about all of us. Okay, so key achievements and highlights. So we've continued to support our consumers, aged care residents and communities through the ongoing impacts of the COVID-19 pandemic. As we all know, the world seems to think that it's all over, but in fact it's not. Influenza and respiratory viruses. The rollout of SA Health's electronic medical record, Sunrise, EMR and PAS, which stands for Electronic Medical Record and Patient Administration System. That's a major step forward for us in providing continuity of care for people, not only within our local health network, but across the whole state. And by I think it's March, all of the state will be on that, and Wayne has been instrumental in driving that progress, which those of us who've been in the system for many years, it's been a long, long time coming. We've achieved 3-year accreditation following assessment under the National Safety and Quality Health Service Standards. Again, that was a major achievement because they had moved from pre-planned assessments to 48-hour notice assessments. So we got 48 hours notice that they were coming, and we passed with flying colours, really. We were the first of the regional LHNs to do that. So that was a very big achievement and a great credit to the staff. We expanded the Riverland Academy of Clinical Excellence, so we employed 24 new doctors across the hospitals and general practice, comprising trainee medical officers, interns and registrars, and we hosted the National Single Employer Model Conference, which I was fortunate to be able to attend part of, and that was, again, an exceptional achievement. We continued our commitment to Aboriginal health and reconciliation and developed the Diabetes Remission Program, and this is, I'm not going to try to pronounce it because I will get it wrong, but that's a major collaboration between us and Flinders University, and is, again, a major step forward in working with communities about how to prevent and manage diabetes in our Aboriginal communities. We assisted with strategies to manage tuberculosis in our community, and you can see there that we've employed 2 Aboriginal community liaison officers promoting TB awareness and having an ongoing collaboration undertaking screening clinics. Again, a disease that we think has gone away, but in fact is always lurking. We created new roles including nurse practitioners, palliative care nurses, a stoma nurse and a prostate cancer care nurse. So all the time we're looking at how we can do more locally for people or with people to manage healthcare. We continued our aged care focus, and it is a major focus. So we've had aged care standards and accreditation events and monitoring implementation of the aged care reforms, which is a complex space. It's evolving all the time. We're having to anticipate and develop solutions that then the detail is not necessarily clear to us. The aged care standards and accreditation events, we're very, very proud of the fact that our 3 residential aged care facilities are all fully accredited. And again, that's a major achievement. Supported the Chief Executive Officer to undertake a statewide incident commander role from May during the Code Yellow due to the demand experienced by the health system. So Wayne was seconded, is one word for it, to go to Adelaide and manage that whole process. And again, that's a recognition of the skills that we have within this LHN. Wayne was also a finalist in National Rural and Remote Allied Health Awards as Excellence in Rural and Remote Health Administration, and that was a well-deserved nomination. And we celebrated the 5th annual RMCLHN Awards, including a Lifetime Achievement Award to Fred, who's here, and NAIDOC Awards. Again, a great night. We launched a number of plans that have been in the pipeline for a while. So these plans have all been developed in consultations, been reiterations, again, making sure that they are relevant and achievable. So launched our inaugural mental health service plan, digital health and information strategy. We endorsed the research framework and research plan. One of the side benefits of the RACE program has been the development of a research unit, which has done an amazing job about bringing research into our communities so that the research actually reflects the needs of rural people, not just metro people. Developed a Manning District Hospital Planning Report. There's been a huge amount of work going on a clinical services plan. I see Kerry in the back there, and that's ongoing, and again, a lot of consultation involved in that, and monitored our strategic plan with ongoing development and implementation of strategies. So these are some photos from various events and the awards of our wonderful staff. Health Advisory Council activities, and I note Sally and Josie in the audience, supported our HACs and their advocacy work for our communities, developed and launched a range of new promotional materials, including posters, pull-up banners and brochures, held our annual conference with the HACs, supported attendance at the Regional HAC Conference in Mount Gambier last year. Berri Barmera HACs held 2 successful Women's Health Nights and fundraising quiz nights, hosted the Select Committee on Endometriosis, received a special commendation at the LHN Awards for outstanding contribution to LHN, so congratulations, Berri Barmera HAC. Coorong Health Service HAC held community information sessions in Canalpin on female incontinence and dementia, awarded scholarships in partnership with Menindee Hospital Auxiliary to assist with young person studies from enrolled nurse to registered nurse. Very, very important in that pipeline of increasing our local nursing skill mix. Loxton District HAC held their inaugural Navigating Aged Care Expo in October 2023 and have just held another one. And we're a finalist in the LHN Awards for outstanding contributions again, so congratulations to Loxton. Mallee Health Service HAC assisted Coorong District Memorial Hospital to upgrade facilities, provided blinds for the outdoor area and donated wardrobes for the units and hostel at Pinaroo. Mannum District Hospital HAC continued their financial support for staff to upgrade their training and qualifications, supported their replacement and upgrade of equipment for the hospital work services area. And it goes on. Murray Bridge funded a defibrillator and a ring cutter machine, hosted the centenary celebrations for the hospital in August 2023. Renmark Paringa, where the board was earlier today, held their inaugural Aged Care Expo in March 2024 and held a baked goods fundraising stall in collaboration with the Ladies Auxiliary and staff. And again, we're a finalist in the awards for outstanding contribution to the LHN. Waikerie District's HAC supported continued improvements in aged care and acute areas of the hospital and continued their support of graduates. And photographs of many of the interesting things that were and very productive things that the HACs have been undertaking in the last year. Oh, excuse me while I try to get this to move. So challenges and areas of focus. It's no surprise to anybody that staff recruitment, retention and wellbeing are a major focus, not just for us, but rurally and remotely, nationally, and not only rurally and remotely, so in metro areas as well. So that's been a major focus for the Governing Board during the last year. Workforce planning was the topic of the discussion at our annual planning day in January. The continued expansion of race is of great interest to the board and to me personally. We have a vision for growing our own workforce, and through race have been able to influence the development of undergraduate allied health professional courses in the Riverland, and soon to be a medical end-to-end course available in the Riverland, which is just fabulous for growing our own. Staff reward and recognition strategies, including a scholarship program. There's been increasing demand for services within RMC, so not only the Code Yellow was not only about Metro, we have had a huge increase in demand for activities over the winter in particularly, and we've supported statewide initiatives by bringing back people as fast as we possibly can. Aged care accreditation, safety and quality have continued to be a huge focus for us. Diligently monitored and identified challenges, and as I said before, the implementation of the aged care reforms and monitoring the proposed changes to legislation and impacts. And again, for disability, including but not only NDIS, as a focus for our safety and quality. We're increasingly focusing on this, monitoring proposed changes to legislation and impacts for RMC, but also about how does that impact on people, how do all of our services impact on people with disability and how accessible are they? So it's not just about disability, it's services, people with disability access all of our services. So that's been a year in review. It's been a very busy year, and the board, I think, has enjoyed very much meeting the challenges that are in front of us, and will continue to do so. So thank you all very much. And I'll pass you back to Wayne.
Okay, and before I give my update, what I should probably do is ask that we note the minutes of the 2023 annual public meeting held on the 2nd of November 23, and they have been confirmed at the Governing Board meeting on the 24th of November 23, so there is actually nothing for us to do other than to note them. So take them as noted. Elaine's already run through a whole lot of things in terms of the past year, but I guess, you know, we've had COVID-19, as Elaine touched on, then the Murray River flood, Japanese encephalitis virus, and so in a sense, we are now in that recovery year that most other health networks were in the year immediately following COVID. And therefore, we're experiencing a lot of the staff burnout and distress that other health networks recognised sort of a year ago, because we've been in that extended period of crisis with the floods and then Japanese encephalitis virus. So, that means that we are under a lot of pressure in terms of nursing workforce. We're actually doing comparatively well at the moment in terms of allied health workforce, but it varies over the year. We do really well at recruiting early in the year and then slowly lose them over the course of the year, and then we recruit them again. And of course, as you've heard through the Riverland Academy of Clinical Excellence, or RACE, we're doing pretty well with medical staff, but nursing staff is a real challenge for us at the moment. It's been a year of growth and evolution, and it's been a challenging year in terms of health service demand, and as you heard Elaine say earlier, particularly the first couple of months of this new financial year, but of course, April and May of last financial year going into June were big months for the health system. The whole of the South Australian health system was in a crisis, and that led to the Code Yellow response across the whole of the South Australian health system. Some key achievements and initiatives. Some of these Elaine's already touched on. As an LHN, we continue to support our communities to stay safe and well through COVID-19, also through the floods and through those other challenges. Obviously, following COVID-19, a period where people had been self-isolating and very careful about who they were in contact with when, as societies opened up more, other respiratory viruses have started to circulate in the community more, so influenza and other respiratory viruses have also started to have an effect. Elaine touched on the Sunrise electronic medical record and patient administration system, which I'm in the process of leading the rollout of across 59 hospitals across South Australia. We implemented that in our health network in the tail end of the last financial year, and now, of course, all of our health services are live, so that's fantastic in terms of having a single instance of a health record. If someone attends one of our hospitals and has a need for a follow-up visit to any of our other hospitals, their records are available because they're all on the one health network. So just in terms of continuity of care, reduced duplication of tests and so on, it's great for the population. We continue to focus on clinical education and the race ground rounds, and we've held a couple of emergency response conferences, which are really quite exciting and have engaged people from across South Australia really, and coming and attending our region and learning emergency medical skills, and also people from other agencies, fire and ambulance and so on, learning how to respond to emergencies as well. So the Riverland Academy of Clinical Excellence team and the medical education team have done a fantastic job with that. We continue to progress our operational plan, which is really the way that our strategic plan is brought to life, and the way that all of the different plans that you will have heard Elaine talk about just before are brought to life into one overarching plan with all of the actions for the current year. And coming into the new financial year, we've started, as you heard Elaine speak of before, developing a clinical services plan, and that clinical services plan will roll into the refresh of our strategic plan, which expires next year, 2026. And do want to just also acknowledge the fantastic work that health advisory councils do for our communities, their advocacy for their communities, and also the huge amount of work they do in terms of fundraising for the communities as well. You've got some photos there. You can see, for example, just up beside me, an example of one of those emergency exercises, made to look and feel real, so that people develop a real appreciation for what it's like to respond to an emergency situation. Go to the next slide. I did just touch on the community services plan, the clinical services plan. The clinical services plan is really a process where we go about seeking to understand the current and future needs of our community. We do that by engaging with the communities. We do that by looking at demographic information and forecast changes in the population. And we seek to co-design ways of addressing those future health needs, both with our clinical teams and with the communities. And so there's been a whole lot of workshops, and the clinical services plan, will continue to evolve and develop over time. And there'll be public consultation on it when we've got it to a point where it's ready for that. But at the moment, it's still very much in the development stage. We have a design team that are governing the project and overseeing its development, milestones and timeframes and so on. And we've held activation workshops, community consultation, engagement meetings with HACs and shared information, community surveys, and a lot of analysis and feedback. We've collected consumer stories through interviews and so on. And as I mentioned before, our clinicians and partners are engaged across 9 clinical services streams in developing up the plan. There's a link here. Do encourage anyone that wants to have a say or wants to see what's already been said and where the plan is in development to follow the link and to interact with the information that's available and provide any feedback that you might have along the way as well. In terms of the Riverland Academy of Clinical Excellence, Elaine's sort of already touched on that in a lot of detail. It's got several different arms, one around clinical teaching and training, so the training of medical staff from internship to fellowship as rural generalists. It's got a research arm, and we're engaged in actual clinical research in a regional setting about the health needs of rural and regional people to develop the evidence base that care is based on in the context that it's delivered in, instead of relying on evidence developed in large tertiary centres and trying to apply that in a regional location. We are also involved in public health in terms of research on Japanese encephalitis virus, research on diabetes remission in Aboriginal people, and so on, and seeking to improve the health outcomes of our population through the research that we're doing with race. The race medical training program continues to be very effective. It's currently got about 40 participants at all different levels of clinical training, and will reach its full potential really in terms of 50 participants next year. So it's really quite exciting in terms of its development. And from then on, we'll aim to have 50 trainees, advanced trainees, in the program right through. So 10 coming as interns and 10 graduating as fellows each year, and sort of 10 at each stage in between. Although the actual mix will depend a bit on who we recruit and where they are in their training development so far. We obviously through RACE we've been instrumental in developing the concept of the single employer model. Single employer model, or SEM, really is just an employment and funding arrangement whereby one organisation acts as the employer of trainees through their entire training program, in our case from graduation with a medical degree through to fellowship as a rural generalist or a GP. So it's the mechanism by which we can get funded for the work that they do in a private general practice while they're our employee. And that really has become a cornerstone of Commonwealth funding policy for medical training in rural areas, and a strategy of the state government in terms of attracting medical staff to rural areas across all of regional South Australia now. Also, RACE has held its inaugural clinical audit program, and we have developed and delivered the first cohort of the RACE Clinical Leadership Program. Do want to acknowledge Dr. Hamish Esk, who was awarded the South Australian Medical Education and Training 2023 Clinical Educator of the Year as well. If we move on to the next one, quality and safety, Elaine's already touched on this. We have 3 years of accreditation with no outstanding not mets and no outstanding recommendations even for our National Safety and Quality and Health Services accreditation, and all of our residential aged care facilities currently have full accreditation as well. So that's an amazing achievement by a whole lot of people at all levels of our health service, really, ranging from individual staff working with patients through to directives of nursing and clinical leaders, nurse unit managers, and of course our health advisory councils in terms of some of the fundraising and advocacy that they've done as well for their health services. And of course we have food safety accreditation at all of our sites, as you'd expect as well. Some more photos. We just move on to Aboriginal health. We've done a lot of work in Aboriginal health, really aiming at increasing employment opportunities for Aboriginal people in our region, including employment opportunities with us as an employer. We've launched the Traditional Custodians Project and actually identified the traditional owners of some of the lands in the Riverland, whereas in the past, dare I say it, I would have, instead of acknowledging that we're on Coorong country, I would have mumbled something and then said that I acknowledge the First Peoples of the River Murray, which is technically true that Coorong people are amongst the First Peoples of the River Murray and other First Peoples acknowledged in Berri. We've expanded clinics and services for our Aboriginal health group in Barmera, including an elders group, a hearing clinic, optometry clinic, a yarn and feed group, a social work clinic, ACAT assessment clinic, diabetes clinic, and drop-in paediatric clinics. And we've expanded GP services for Aboriginal people, including providing a specific GP service in Renmark for Aboriginal people. We've implemented cultural immersion programs for all staff so that the entirety of our workforce have an opportunity to learn about culture, traditions and heritage of First Nations people. And we've continued our commitment to address racism and have a mechanism through the safety and learning system, electronic system, for people to report incidences of racism. We've continued to support Aboriginal artwork programs, unveiling the Berri Early Intervention Centre, Child Development Centre artwork, but we've also engaged in some artwork planning work for the interior of our emergency departments, which is still in development. And of course we've continued to support our Aboriginal employee network as part of our program of supporting our Aboriginal workforce. We just go on to the next one. Nursing and midwifery, we're currently in the process of working to transform the way that we provide nursing education, really along the lines of the Riverland Academy of Clinical Excellence, so to expand the range of postgraduate education service opportunities available to our nursing staff. We did have 30 registered nurses commence employment through the TPPP program last year, 5 enrolled nurse cadets. We've delivered palliative care or developed palliative care nurse practitioner roles. continued to develop the midwifery group practice model, which is now in place across the entire region, and participated in the Every Week Counts National Preterm Birth Prevention Collaborative. I think on top of that, we've also had our own scholarship program. And the thing about our internal scholarship program, really, and I'm say it publicly so that any of our staff that are interested in and watching this hear it, is we actually awarded scholarships to every employee that applied for one. No one that applied for one missed out on one. So if people who work for us are interested in developing their skills and careers and want to apply for funding or a scholarship through us, I absolutely encourage them to when that opportunity comes up, and there's a more than reasonable chance that we'll back you. We launched a new staff survey and a separation survey just to help understand what attracts people to our workforce and also what drives them away. We developed and implemented action plans aligned to the various staff engagement surveys that have occurred in 2023 and previous ones, such as the whole of government ones as well. Mentioned the scholarships and our annual staff awards really celebrate the innovation and achievement of staff from right throughout the organisation, volunteers, health advisory council members, GPs, and of course the Lifetime Achievement Award went to one of our board members who previously served on the Murray Bridge Hospital Board and then as presiding member of the Murray Bridge Health Advisory Council, Fred Tubert. We have implemented monthly training focus areas, developed a whole lot of new initiatives for nursing recruitment coming into the new financial year, including international nursing recruitment, and rolled out and continued some of our development of allied health, nursing and non-clinical recruitment campaigns. Some corporate services achievements there. I won't read through the numbers, but obviously we continue to invest in clinical equipment, minor works and capital development, asset sustainment projects such as the upgrades of clinical sterile supplies departments, which haven't all gone to plan, but are really essential to the ongoing delivery of surgical services in the region. Implementation of 24/7 security at Riverland General Hospital and Murray Bridge Soldiers Memorial Hospital, and a continued focus on environmental responsibility, including reporting on our carbon consumption and really just aiming to lift our game in terms of understanding the impact that we have as a health service on the environment. Struggling with my papers here. A couple of other things, initiatives. One is the rollout of the statewide interfacility transfer process, which we as a region rolled out last financial year and which was mandated and is now compulsory statewide as part of the Code Yellow thing for all health services. We were the first regional local health network to roll out the electronic referral system, and we've implemented a rapid access paediatric clinic enabling free healthcare consultations for children with a local doctor at their school in Renmark. Talked about expansion of Aboriginal health clinics already, and obviously, as you can read, developed a stoma care and prostate nurse care service as well. Had a number of key personnel changes, new people starting, people retiring, a whole variety of different changes, and it's, I guess, really quite interesting that the departures of key personnel have tended to be retirement rather than moving, to a different opportunity. So that's really pleasing to see as well in a lot of ways. That, I think, is really the end of my report, and I'll hand over to Craig for the finance report.
Thanks, Wayne, and good evening, everyone. I'll just run through the financials very briefly. We actually finished the year on interim results about a bit over $10 million overspent, but as happens every year, the department do a number of adjustments to our income and expenditure and also to our budget, which meant that in the final analysis we're about $8.5 million favourable to budget, and that was largely due to a write-back of a fairly substantial liability arising out of workers' compensation in the previous period. So it might look like a very favourable number, but it was really the product of a once-off accounting adjustment. So what was our total expenditure for the year? It was $234.9 million, so it's around 2.5% of the total state budget of $8.2 billion. Our net assets for 23-24 are $150.8 million, and the audited financial statements for 23-24 have been finalised. I think we're still embargoed from actually releasing them, but
we have copies of the report here tonight, but until it's tabled in Parliament.
I think I should also just report that for the first time in its history, this LHN received a qualified audit report, as did every other state government funded agency right across South Australia. And that was really about an election commitment which was made by the current government that as many goods and services as possible would be procured from South Australian-based companies. And so it was decreed that we would include as a disclosure note in the accounts the percentage of total goods and services spent in South Australian companies and those not. So all of us collectively provided that information, but the auditor in the final analysis wasn't happy with how those calculations were done. So they've chosen to qualify the accounts on that basis. So it is only about a disclosure note, and it's around Treasurer's Instruction 18. And I think that's probably all I've got, unless there's any questions. Thanks. No? Thank you.
Okay, so that sort of concludes the structured part of the annual public meeting. Are there any questions? I think we've got one online, so.
I do have one online. Is there a strategy to support people with disabilities, parents and carers or friends? Is there any scope to create one for inclusive practices within the RMCLHN?
So the question is, and I'll paraphrase a little bit so that people online can hear, is there a strategy to support people with disability, carers, friends, parents, etc.? We do actually have a couple of different disability and action and inclusion plans. One is targeted at our workforce, and one is targeted at the general population. And that should be available on our website, but if it's not, we can check tomorrow and see whether or not it is and put it on the website if it's not, so that it is available. So we do actually have a disability access and inclusion plan. On top of that, there's a disability access and inclusion section in our quality and safety plan, I believe. And that's public as well. The quality and safety plan's updated annually from memory, and the disability access and inclusion plans are updated 3 yearly from memory. Any other questions? Yeah?
I do have a follow-up question.
Yeah.
Why is there aged care exposed in the area and not aged and disability care exposed in the area?
So the question, I'll just repeat it for people online. Why are there aged care exposed in the area, not aged care and disability exposed in the area? The aged care exposed that have been organised by the Health Advisory Councils, really on behalf of their communities or to support their communities. It's probably because there's, people have a lot of challenges navigating aged care, and we're a large provider of aged care services, both in the community and in people's private homes. Disability, it's a good question. Disability services, we are an NDIS provider, and of course in both circumstances it's actually the Commonwealth that coordinate access to care across aged care and across disability services. But yeah, it's primarily because that innovation in terms of the expos has been organised at a local level by local people and in response to issues that have been raised with them. So it's entirely possible that disability will be included in those in the future. Any other questions? None others online?
I have a comment. The person that posted that question has commented based on your response. If you'd like me to share that.
Sure.
Glad to hear there's a plan for our disability community. As a mum of an autistic daughter, getting therapy has been a huge challenge with her age.
Yeah, so people online will be able to read that response. Obviously I can't read it online while I'm up here, so I won't repeat it, but it has just been read out here. Just out of interest, relevant to that, we have recently signed a memorandum of understanding with Women's and Children's Hospital or Health Service to try and increase the availability of paediatric services in the region as well, because I know that's a severe issue for access for people who have got, children with disabilities and or development delays. And no doubt will be flagged in our clinical services planning process as well. Okay, anything else? I'll close the meeting. Thanks everyone.